Today we're going over how long does it take to recover from common running injuries. Let's do this. First and foremost, thank you so much for your support. You truly allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist. I'm a coach, personal trainer, and meathead. I love working out. I love lifting heavy things. I love doing fun fitness stuff. This is the Fitness Pain-Free Show, where we help coaches and physical therapists like you get your patients out of pain and back to training. If you're watching this on YouTube, please hit that like button, comment, and subscribe to the channel. If you are listening via podcast, please rate and review. It helps me out greatly. So, if you want to support me that extra bit, consider subscribing to Insiders. It is a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for trainers and physical therapists. It's my premium content from yours truly, myself. I've been spending years and years creating this library. We're over 5 years at this point. We update it every month. It's got over 100 webinars, ebooks, and complete guides. You've got access to a private Facebook group to have all of your questions answered by me. You can decide upcoming podcast topics, and you can get started for $1, right? $1 for a week trial. That's crazy cheap. After that, it is a subscription membership. It's $9.99 per month. Again, dirt cheap for what's in there, and it really helps me out, all right? So if you want to try to support me, this is the way to do it. And lastly, you can cancel anytime. So to get started, go to fitnesspainfree.com. Click on the programs link, and then click on Fitness Pain Free Insiders Online Library, and subscribe. Okie doke. Let's get started here. So why are we covering this topic today? Well, first and foremost, I feel like this is the million-dollar question. All my patients kind of ask me this question. How long will it take my injury to get better, right? And that's hard because obviously it's very variable from person to person, but it's nice to give some ballparks, right? We want to give people some answers. We want to help to set some expectations. Is this going to take 1 month? Is this going to take 2 months? Is this going to take me an entire year, right? And that's helpful because we can set those expectations and then people will not freak out when 2 weeks later they're not completely better, right? And also can guide the way you treat this person. So if I know it's going to take 6 months or so for someone to get better, then I know that I can kind of space out my visits and set up those expectations for my patient and have them have the best possible experience, right? So think about running. It's a popular form of exercise, right? I do it. I run 2 to 3 times a week. I've been doing that off and on since I was probably about 15 years old. I'm a big fan of running. And generally speaking, it's very, very good for you. I thought this was an awesome statistic right here. Runners have a 25 to 40% reduced risk of premature mortality and live approximately 3 years longer than non-runners. So if you're running, great for your health, right? It's a great form of fitness, help extend your lifespan. The other piece that injuries are common. I'm not saying that running in particular is bad for you per se. Like I said, it's good, but injuries are common in running. And it is, at least in Denmark, the number one sports-related injury. And it has an annual injury incidence of 43 to 85%. So if you are a runner, and in this study it was recreational runners, so people that run somewhere between 1 and 3 times a week, you're likely to get hurt about 0.5 to 1-ish times per year. And that can represent a significant healthcare cost. People go to the doctor when they have an injury. The other piece it causes disability. People aren't able to engage in fitness and recreation, and obviously we need that for so many things. Being healthy is something that's super beneficial. It definitely saves tax or healthcare dollars, and it's good for mental health. It's good for so many things, right? So we want to try to keep people running, keep people in fitness if possible. So what were the study's goals here, right? What was interesting is they were looking at how long does it take for complete symptom resolution to occur following a running-related injury in recreational runners, okay? And what I really liked about this study is that if you start looking at research on certain pathologies, let's say patellofemoral pain, right, or rotator cuff tendinopathy, another super common type of injury, you'll see exercise oftentimes is helpful in reducing symptoms. It can knock pain levels down, it can improve function, but it doesn't always mean you have complete symptom resolution, and that's important to understand. What was cool about this study is that we're looking at how long it took for people to get completely better, to the point where they don't feel their injury anymore, and it's not interfering with anything within their life, right? And that was pretty neat, because oftentimes you're looking to see if you have a significant change in pain or disability. This was looking at how long it took to have a complete symptom resolution, right? And then one of the reasons why they did this study is there's a lack of research in recreational runners specifically. So there's some prior research in novice runners, right? And then in more elite level runners. But how about the folks that, you and I care about, folks that run a couple times a week, right? That's important just because that's a huge chunk of the people I see on a regular basis, right? So their definition of a recreational runner was someone that runs 1 to 3 times per week, and they had to have been doing this for the past 6 months, right? And in novice runners, the prior research shows the median time to recovery of all types of running-related injuries. So this may be plantar fasciitis, this could be IT band syndrome, patellofemoral pain, all those things, took approximately 10 weeks to get better, right? And the secondary goal of this study was to see what are the most common injuries in recreational runners. So in terms of the subjects in this study, they used injured participants in the Run Clever trial. Now, the Run Clever trial was pretty cool, and we may cover this in the future, but this is not for today. But it was a trial comparing the risk of injury in running programs, emphasizing either an increase in volume over the course of time or an increase in running intensity where they kept the volume controlled over the time. So it just basically wanted to see if we ramp up volume, is that going to cause more injuries? Or if we ramp up intensity, is that going to cause more injuries, right? So they took folks from that study. And it was a 24-week follow-up study. They used recreational runners, the definition we just described, and the outcome measure was running-related injuries, RRIs, is as I'm going to be talking about it, and in the literature you'll see this quite a bit. And they tracked this with weekly questionnaires. Okay, so the inclusion criteria for the Run Clever trial runners, folks were between 18 and 65 years old. They had to be free from an injury in the past 6 months. They had to be this definition of recreational runners, so 1 to 3 weekly sessions over the past 6 months. If you ran more than that, you were no longer recreational. Or if you were more competitive, I guess, at an international level, you would be out. And the other piece is they had no contraindications to vigorous exercise from the American College of Sports Medicine's definition, right? These runners were all in Denmark. And the sample in this study, they had at least one running-related injury at follow-up. So they didn't have all the people in the study. They just took the folks that ended up getting hurt, right? So what about the methods and materials? The participants were given the OSTRCO, Overuse Injury Questionnaire, to fill out, and it was adapted for runners. So basically this OSTRCO outcome measure will have a given joint or area of the body, and then it'll ask 4 questions about that injury. So this was adapted for runners because generally speaking, runners have lower extremity issues, maybe some low back issues. They didn't want to ask just about shoulders and elbows, right? They wanted to make sure that they were capturing true running related injuries. So looking at foot, ankle, front of lower leg, calf, knee, thigh, hamstrings, groin, glutes, hip, and low back issues, right? And the questions were specific to the joint, and I'll read through these so I have an idea of what the questions are. So question number 1, have you had any difficulties participating in normal training and competition due to knee problems during the past week? And it's full participation without knee problems, full participation but with knee problems, and you get it, kind of so on and so forth, or cannot participate due to knee problems. Question 2 was, to what extent have you reduced your training volume due to knee problems during the past week, right? Question 3, what extent have knee problems affected your performance during the past week? And question 4, to what extent have you experienced knee pain related to your sport during the past week? So this is one of the ways they're trying to quantify injuries in this study. The injury definition that they used was any physical pain or complaints from muscles, joints, bones, or tendons of the lower extremities or back as a result of running. And it had to reduce the training performance, such as distance, frequency, intensity, or pace, for at least 7 days. So if you have a relatively minor injury that set you back for a day or two, they didn't count that, right? It really had to reduce training performance, like distance, frequency, intensity, or pace, for 7 days at least. So it wasn't capturing everything, especially that's on a very, very low or minor scale. It was trying to come up with some sort of way to quantify the severity of the injury, because if it's not bad enough, they don't want to capture that, right? So that's how they defined it anyway. When a participant reported a running-related injury via the weekly injury questionnaire, an appointment was made with a certified physiotherapist, right? And this was actually kind of cool the way they did this. The physiotherapist at that point diagnosed the injury, but they gave them no treatment plans for rehab, okay? So basically, someone came in after an injury and they said, oh, you have shin splints, right? But they didn't tell them, hey, change your running volume, do these exercises, XXXYY treatment. They didn't do that. They didn't actually treat these folks. They just diagnosed them and sent them on their way, right? The participant was allowed to search for treatment and receive treatment elsewhere. So one of the limitations of this study was that some of the folks probably got some sort of physical therapy or physiotherapy, and some folks probably did not. We don't know which ones did and how many folks went to physical therapy versus how many didn't. We just don't know that, unfortunately. So what was the definition of recovery right? If someone's getting better, how do they define that? The date total pain relief occurred was defined as recovery, right? And it must be followed by at least 3 weeks without pain. Because oftentimes you feel 100%, you get back to running, feeling pretty good. 2 weeks later, all of a sudden, it hurts again, right? And if that was the case, then that's not defined as recovery. There are some folks that probably by the very end of the study had recovered, although they didn't have those 3 weeks without pain. So there's a chance that the information or data was skewed because of that. If a participant was pain-free for a week but reported pain the following 2 weeks, the participant was still classified as being injured, like I said previously. And then runners who did not have a recovery before the end of the study were excluded. And this is actually quite a big problem, and that could heavily skew the results, right? So here's the thing. 112 people with injuries were included in this study. 35 of those folks did not recover by the end of the study, okay? And they were just dropped off. Okay, so basically about a third of the folks that got injured didn't recover over those 24 weeks, right? And that's a big problem because the data looks like people were recovering probably a little bit faster than they actually did, okay? Good example was medial meniscus injuries. I think it was 3 of those folks recovered out of 7 total injuries by the end of the study. So the amount of time it takes to recover for a medial meniscus injury is probably not accurate. In this study, they said the medial meniscus, shin splints, IT band syndrome, and Achilles tendinopathy, the folks in those groups who became injury-free ranged from 42% to 70%, right? So in those folks, a big chunk of those did not get better over the course of time. And it could just be that their injuries occurred towards the end of the study, right? So they didn't have enough time to recover, but there's a chance it occurred in the beginning of the study, right? I didn't go in and look at the exact injuries and get an idea of how long each individual injury occurred, although you probably could contact the authors and get that information. But what this is saying is that we're probably not getting a very accurate idea of how long these took to recover just because the study wasn't long enough and we threw all these folks out that did not recover over the course of time. So that's going to skew the results and something to keep in mind, right? So they had 839 total runners. 62% of those were female, 38% of those were male. The mean age was 39.2 plus or minus 10 years, which is kind of cool. They had a group of athletes and individuals that weren't quite that old or that young. I feel like this is pretty representative of the folks that I work with on a regular basis. The mean age of injured runners was a touch higher at 41.4. I don't know whether or not this was significant or not. I doubt it. Doesn't seem like it's very much of a change. And this is kind of interesting. Of the injured runners, 73% were female and 27% were male, right? So you're seeing a slight uptick in female injuries over male injuries. And 32% of runners were injured over 24 weeks, right? So 24 weeks, about 6 months, 1/3 of those folks ended up getting an injury. If this was extended out over the course of a year, that would be about 60% of folks had some sort of injury over that time period about. So it gives you an idea of maybe the injury rates for runners, right? If you're a recreational runner and you run 1 to 3 times a week, there's about a 60% chance that you're going to get injured over the course of a year, okay? And the most common injuries, and I'll read these through, and this is basically the first thing I'm going to say is the most injuries, and the last thing I say is the least amount of injuries. So the top 5 were medial tibial stress syndrome, or shin splints, followed by Achilles tendinopathy, patellofemoral pain, IT band syndrome, and then plantar fasciopathy. As we move down the list, we have less and less injuries. So gastrocnemius injury, glute medius tendinopathy, medial meniscus injury, hamstring injury, soleus injury, ankle distortion, greater trochanter bursitis, patellar tendinopathy, quads injury, psoas major injury, peroneus tendinopathy, Pezan serine injury, adductor injury, external coxus saltans, flexor hallucis longus tendinitis, hallux valgus, Morton's aroma, SI joint injury, low back injury, and a stress fracture column femoris, which is just one injury. So again, the top 5 are going to be shin splints, Achilles issues, runner's knee, IT band syndrome, and plantar fasciopathy. Okay? And this is kind of cool. They give you an idea of how long it took to recover from all injuries. The overall median time to recovery, right, complete symptom resolution, was 56 days, regardless of the diagnosis, right? So if you lump all of those injuries together and just see the average period of time it takes to get better, about 56 days, right? So looking at about 2 months or so. The shortest median time to recover, so a thing that seemed to recover the fastest, was plantar fasciitis, right, with 35 days. And I got to be honest, that this is not really consistent to what I've seen with folks in the gym and runners. And that was actually a little interesting to other people. So when I posted this study initially, a lot of folks were saying, oh, plantar fasciitis, that's fast. Doesn't seem like it's that quickly, right? But that's what the study showed. And the longest time to recovery, the injury that took the longest time to recovery was the medial meniscus. And this was at 89 days for a medial meniscus injury to rehab. However, only 3 of 7 recovered in the time frame of the study. So there is a chance that the medial meniscus injuries would take a lot longer to recover or potentially don't fully recover, right? A lot of injuries that you see, once they get started, and this happens a lot with recurrent injuries, they kind of stick around in the background. So it might also be a sign that these medial meniscus injuries and some of these other injuries that take a long time to recover, maybe we don't get that full symptom resolution like we do with some of the other types of injuries. Not exactly sure, right? So we don't have all that data, but that's one of the things that starts popping into my head. I start thinking about that. And then 8 participants suffered 2 running-related injuries. So of all of the injuries, I think there was 112 of them, 8 participants had 2 running-related injuries during this time period. Okay? Now, in terms of the injuries that took the longest to recover, we said already the medial meniscus was the longest to recover at 89 days. I'll just read through this list in terms of the ones that took the longest. So medial meniscus injury took the longest, followed by hamstring injuries, which, to be honest, I was actually a little surprised about, followed by medial tibial stress syndrome, followed by glute medius tendinopathy. Now, I will say that glute medius tendinopathy, for me, sometimes it's kind of the bane of my existence. I have a hard time getting that to get better in a lot of folks. So that does make sense to me. Followed by IT band syndrome, and then Achilles tendinopathy. Interestingly, patellofemoral pain was right next to that at 49 days. But medial meniscus injury took 89 days. Median time to recover, keep in mind only 3 out of 7 actually recovered over the time period, so it's probably much longer than that, and or those folks just don't recover as well as some of the other types of injuries. And then patellofemoral pain at the end was 49 median days to recover, right? So what are the conclusions to this study, and what's kind of our discussion? So first and foremost, one of the biggest limitations is it's a pretty short follow-up, only 24 months, which is actually not bad, right? 6 months is not bad, but we probably missed the recovery of more serious injuries because of this. Like I said, the medial meniscus injury took an average of about 90 days to get better, right? And we probably would have gotten some better information if we followed these people out closer to a year or so and maybe stopped recording injuries at the 6-month mark, so we didn't get an individual that didn't have the opportunity to recover over the time frame of the study. That might be a cool thing to see in the future. And like I said, we're not capturing several injuries that did not recover yet. Around 30% of all the injuries in this study, we didn't see them recover over the course of time. And that's simply because the study was probably not long enough, and or a lot of individuals don't make a full recovery. They had a pretty stringent definition of recovery, right? I will say that I have several injuries all over my body that I feel from time to time, and they will limit my training from time to time too. So they would probably qualify as an injury based on this study, but they don't really bug me too much, right? And I'm not concerned that it's not completely recovered, right? These guys wanted to see that complete recovery that wasn't interfering with the training at all. So what are our clinical takeaways, right? First and foremost, I think it gives patients more information that they really like. And I know one of the trends right now in the social media world is that we don't want to overdiagnose folks. But I think the biggest problem here is that folks want a diagnosis badly. So I don't think it's a bad thing to give people a diagnosis. As long as you don't scare them with a diagnosis, you decrease the fear about it, you tell them it's okay to have this injury, they get better over the course of time. Really, I think if you can give someone a solid diagnosis, right, and give them an idea of how long the average person takes to recover, it really solidifies you as an expert. It helps to really build rapport and build trust. You know, my patients love to hear this. When I start saying, oh, okay, this injury right here takes an average of this long to get better. For most folks, it takes a little better or a little longer for some, a little shorter for others, and this is what I tend to see. I think that really helps people out. They love to get that information. They have an idea of how long it's going to take, right? And it makes you seem a lot smarter and better as a physical therapist. And I think that the other thing it does, it helps put people at ease, right? I can't tell you how many folks will have pain for 2 weeks, 4 weeks. It's not better, and they get really freaked out. They think something is really wrong, right? But here's the thing. We give these people objective information. So we give them a little bit of information that's based on research and other runners, give them an idea how long it takes to recover, right? So if someone knows that, okay, you have a medial meniscus injury, these things take a long time to get better, unfortunately. And if you don't feel better in 2 months, that's okay, because it really probably takes closer to 3 or more months for people to start feeling better. I know this is the case for things like rotator cuff tendinopathy, and I tell folks this every single day, right? It's like, hey, this is going to take a while. And people really appreciate that because they know, all right, I can still train. I just have to be smart. And over the course of time, this is going to slowly get better. I don't have to stop training. I can keep doing what I love. I just have to be smart. And people really like that because ultimately their goals are to be healthy long-term and also to get better at whatever activity they want to do, strength training, whatever it is. And they can accomplish those with a given injury. They just have to be smart about the way they train, right? Like I said, it gives people expectations. It takes time to get better over the course of time. They can help guide my treatments. If I know it's going to take 3+ months, I don't have to go gangbusters at the beginning, out the gate. I can take my time to start slowly ramping people into some of my interventions over the course of time. The other thing I think you have to be really careful about, because this has happened to me, if you give people an idea of how long it's supposed to get better, right? And I've done this a bunch of times in, let's say, ridiculous low back pain, because I've seen a lot of folks where it takes a long time for that to get better. If I tell folks, around the 3-month mark or so, you should start to feel much better compared to all the folks that I see in this study, and they hit the 3-month mark and they're still hurting, they freak out. They're like, oh God, something must be wrong. So it's important that folks know that this is just a guideline, right? And in this study, we're probably giving folks an idea that's too short time of recovery just because they excluded all the folks that didn't get better, right? So it's a guideline. It's not a be-all, end-all rule. And you have to be really cautious about telling people you're going to be better by this time frame, because if they're not, they may freak out. And you know what? It's not bad. It just takes a little longer for some folks to get better, right? But the other piece is that if people are not recovering within a given time frame, right? Maybe your treatment needs to be changed. Maybe this individual has a different diagnosis. Maybe they need to be sent to a surgeon or another provider. So that does help you as a clinician make a better judgment about what their next steps are, right? So that's it, guys. Thank you so much for the support. If you are watching this on YouTube, please give me a thumbs up. I'd love to hear your comments. Submit a comment. Tell me what you think. Is this what you've seen in your experience with other runners? What are your thoughts on this study in general? What would you like to see in terms of future studies? If you're not already, please subscribe to the channel. If you're listening to this as a podcast, please leave me a 5-star rating and give me a nice review. That helps me out so much. It helps the algorithm. Again, I love doing this for a living. If you really appreciate that, want me to keep putting this content out, definitely help me out. Please, please, please. And lastly, if you want to go that last step and support me financially so I can continue doing this type of stuff in the future, head over to fitnesspainfree.com. Click on programs, click on Fitness Pain Free Insiders online library. I'll give you a 1-week-long trial, just $1. After that, it's just $10 a month. You can submit some ideas for future podcast episodes, and you get a ton of learning. Like I said, 5+ years of content I've created. It's absolutely ridiculous how cheap this is for how much value is actually in there. All right. Thank you very much, guys, again, and I'll talk to you on the next one.